everyone. This is Diane Rasmussen McAdie with UK Column. I'm delighted to be joined today here with Catherine Vandome and with Dr. Liz Evans. We're going to have a very interesting conversation today, I believe, about a variety of issues. Catherine, since you're the guest with us today, could you please maybe introduce yourself and tell us a little bit about your background and why we're going to have this conversation today?
Hello, and thank you for having me on to UK Column. Lovely to meet you, Diane, and Dr. Liz Evans as well. I'm a stand-up comedian in recovery from very severe ME. I'm also a podcast host, and my book is out now, and it's called The Truth About Me. So the purpose of today is to help save lives from anybody who is currently suffering from this chronic health condition. And I campaign through Parliament to change the NICE guidelines. And of course, hopefully my story will help save lives.
Thanks, Kathy. And Liz, welcome to this discussion today as well. I know you've been on UK Column before, and so a lot of our viewers will know you, but maybe if you would introduce yourself, and also if you wouldn't mind telling us a little bit about ME as the doctor in the group today.
Hello, everyone, and thanks for having me on. And I'm really excited to talk to Catherine. So I'm a retired doctor. I work in complementary medicine now. I'm also the CEO of the UK Medical Freedom Alliance. We campaign on medical ethics. But ME has a really special place in my heart because I actually suffered from it, quite severe ME in my mid-20s following a flu vaccine that I had when I was a junior doctor. So I had 2 years off work and I had to put a lot of effort into recovering and in fact using one of the techniques that Catherine talks about in her book, the Perrin technique. That was part of my recovery. So when I heard about this, I thought I really want to talk to Cathy. So myalgic encephalomyelitis, which is what ME stands for, is it's a sort of multi-system disease. It is not just, so they also call it chronic fatigue syndrome. This is way more than fatigue. This is, you get post-exertional malaise. So it's, as Kathy said in her book, it's not what you do, it's what happens afterwards. So people just have literally no energy, no reserves. They might do something and then they'll be wiped out for days afterwards. It's inflammation in your body, it's toxicity. And I know Kathy has a really clear knowledge of the neuroscience and the science behind it. So I'm going to leave that to her to explain more later on. But it is an absolutely devastating disease to have. It affects every aspect of your life.
Is it something that affects different people differently, or does everyone have the same symptoms, or can it show up differently?
I mean, as Kathy says in her book, it can affect anyone. I think it has multi-causation behind it. So different people will have different causes. It's often got multiple causes in one person. So lots of different things, physical, environmental, psychological, emotional, lots of stressors on their body over time break down their health. And then there can often be just a final sort of tipping point. So in my case, it was the flu vaccine, but I don't think on its own that caused it. It was lots of things over many years that had undermined my health. So, and this is why Western medicine really struggles with ME, because we have quite a reductionist view, like one thing, and one illness must be caused by one thing. And that's just not the case with ME. Different people will have different toxic exposures or traumas or whatever it is that will cause their system basically to break down.
Yeah, that's really interesting. Kathy, I would like to hear you speak about this because we've spoke about this previously, and I know it's in your book. If you could explain the moment when your life changed.
Yes, thank you, Dr. Liz, and also Diane. Yes, I collapsed in 2014 and I was bedbound. So I suddenly collapsed forward off the front of my settee, blacked out. And after that, my life changed forever. So I'd literally just been running a children's theatre school by day. I was also the top Jessie J tribute artist. So I was literally in big stilettos, jumping off the front of the stage, highly energetic, singer, dancer, actor, and stand-up comedian as well. And suddenly, literally collapsed and blacked out. That's a very faded memory. And my second chapter in my book highlights the terrible sort of tragedy of this and how I had to crawl to my bed, which took hours to get upstairs because I believed I was going to die. And after that, I couldn't even turn my head on a pillow. So just an incredible switch overnight for me. Sometimes it's gradual, but for me, it just suddenly happened. And for me personally, to have been so physically active and able to paint all of my house, I was somebody who never rested, never sat still. I was a workaholic, an exerciseaholic with 3 businesses, and I was also very, very happy and excitable. So there was no way that I had anxiety or depression. And what happened to me, I hope, being one of the most severely affected patients ever in history to survive, is the reason I wanted to share my story when I felt that I would be in a position to share it, which is now. And so it's taken me 8 years to write the book. And just like Dr. Liz has just explained, every single patient is different. So I had a broken flue pipe emitting carbon monoxide hanging off the wall in my kitchen, which we then found had been illegally fitted by a non-gas safe registered plumber. I thought that was the cause, as I broke down all the possible causations in all the years that I was in bed. And what I found out was that actually it was multiple causal, which is exactly what Dr. Liz has explained. And every patient being different, what I do in my book is I take the reader right back to birth, where I was a fast breech birth and my mum had to ring a special bell because the delivery was unusual, atypical. And I was only about 5 pounds when I was born. And apparently, according to Dr. Perrin, who is the neuroscientist and osteopath who has saved my life, he explains with the science, and I put this in the book as well for any scientists and doctors to observe, he explains very succinctly that in his belief, in his PhD in the field of ME, in his almost 40 years of expertise in this particular health condition with peer-reviewed studies and clinical trials, he has an aid to diagnosis, and he also has, he's working in tandem with hospitals and different people to bring this into the foreground so that people understand that what precipitates every single patient case with this condition, he believes, is a structural abnormality of the spine and skull. It has to be both, which then causes issues with the neck alignment, and which we now know affects the vagus nerve, which I'm sure Dr. Liz will be able to explain more succinctly.
Dr. Perrin has been like revolutionary in how he has changed the understanding of ME. And it was really interesting actually reading Kathy's book, because from a medical perspective, she has laid out her life in really fine detail from birth. And you can then see in it all of the multiple physical and environmental and psychological factors that over the years and decades gradually undermined her health to bring her to the point of complete collapse. But in terms of the physical structure, so he's identified that every person pretty much with ME that he's examined has got some sort of structural abnormality in either their head or their spine, which is impeding the normal, natural physiological flow of the fluid from the brain to help the brain to drain from toxins, or the spinal cord to drain from toxins. And somehow these structural abnormalities will impact, therefore, all of the nervous function, so your autonomic nervous system, your fight-flight system, which is your sympathetic nervous system, or your parasympathetic nervous system, which is the part of your nervous system that can heal and repair and help you to sleep. So when those are all out of kilter, you start to you start to lose your health. And then there's this buildup of toxins, which he then identified sort of subsequently. Initially, he thought it was just about the nervous system, but then recognized that instead of the brain, this system draining toxins from the system and expelling them as it should do, it was actually sending it the wrong way. So people start to get this toxic buildup in their brain, which causes obviously effects across all of their systems in their body. So, for example, Kathy, when she was being exposed to carbon monoxide, she could, over many years, she couldn't get rid of that, and the toxicity was building up, and she had issues with paint fumes that she was being exposed to. So you become hypertoxic and sort of being poisoned slowly, and that will affect every system of your body. I think that's probably explained it. Kathy, would you agree?
Yes, thank you, Dr. Liz, and thank you for highlighting the science behind it, because I wanted to explain to medical doctors and scientists. Obviously, I'm not a scientist or a doctor, but I have had my brain drained and body of poison with Dr. Perrin for 8 years non-stop, every single week. So because of the toxicity level, whenever he did the basic Perrin technique detoxification, most people would just walk out, perhaps go back to work. The more severe cases might feel sleepy. But in my case, I looked like Steve Martin in The Little Shop of Horrors. I would sometimes really laugh loudly as all this poison was coming out, and my legs would collapse, and I would literally need to be carried back to the car and then driven back home. So the detoxification has to be done so gradually with somebody as severely affected as myself. Now, I also have secondary fibromyalgia and Ehlers-Danlos syndrome, it's important to say, and they can absolutely be a combination and go in tandem. So if the structural issues, if the structural alignment of the body, and don't forget I was a ballerina, so my hypermobility, my hypermobile joints was fantastic for a career in a magic box, for example, with a magician, but terrible for longevity of life. And you're absolutely right. Dr. Perrin's specialist area is the glymphatic system, which is the drainage of the brain. If that is compromised because the spine and skull are misaligned, and in Ehlers-Danlos, of course, my rib cage, we think on one side, is slightly pushed forwards and my joints dislocate easily. So my neck would pop out of line just asleep. Or 2 years ago, my hip popped out. You can imagine the pain level, but I would just bite my mouth. I would be carried to Dr. Perrin. And because he's an osteopath and a neuroscientist, he said it needed to be somebody with both of those skill sets in the past 100 years to have merged together and worked out why this condition occurs. So obviously, as you explained, there's not enough fluid. We have inefficient drainage of the neurolymphatic system, which causes a backflow and a dual flow of toxins because they can't go through the spine properly. For example, I have a flat upper thoracic spine. So whereas a healthy spine would be like this, a flat upper thoracic is inverted. Then I've also got the rib cage at the front, which is compressed because I've got Ehlers-Danlos syndrome. So as a professional singer, you can imagine how difficult it was to breathe. So I was therefore upper respiratory breathing because I'm qualified in singing, of course, at drama school. And so I was always mouth breathing, which is very common in ME as well, where you're literally taking gasps for air and you can't sleep properly because your entire system is in reverse. So you then crash by day and you can't sleep at night. So that's the wired but tired. But I do want to get across that as much as emotional, psychological components occur, what I wanted to know was why somebody else with the same psychological components, and of course, every human being has got some sort of emotional, psychological process because we're human, why somebody else with the same issue didn't collapse. And what Dr. Perrin has highlighted is that those issues often come to the forefront because the hypothalamus part of the brain controls emotion, sound, light, and that's why all of these components become defective in ME, and the basal ganglia behind there acts as a junction box, and he explains that the basal ganglia controls movement. So if you have toxins in the hypothalamus, the thalamus, and the basal ganglia, then you are going to be like me. You're going to be collapsing all over the place, looking like you're drunk, even though you don't drink. So that's what he has recognized, that it's the structural issues that precipitate, in nearly 40 years of his research, as well as hands-on practical work. Every single patient has structural issues. So what he does is he pops the spine. In my case, my jaw was misaligned from birth, being a fast breech birth. If you come out of the birthing canal too quickly, which is quite common, first births are vulnerable because they get all the toxins from their mother. Breech births, I was breech, came out bottom first and scared the midwife. And so basically, if you have any of these forceps births, of course, and ventouse births, all vulnerable. Now, you would have to have a spine and cranium together. So people who have issues with just the spine may not subsequently get ME. So that's really, really important because it's to do with the alignment of the neck. Now, if you've got Ehlers-Danlos, you've got a very hypermobile neck. So it's amazing for being a ballerina. And at one point I was working professionally with a professional ballet company, the Lewis London Ballet. So it's fantastic for the arts, hypermobility, fantastic for circus acts. And these are the people, sports athletes, entertainers, anybody that is highly active, highly physical. We are the children and adults that sadly often end up with these conditions. Football, weight training, because I was carrying heavy PA speakers every night to my gigs. So I was twisting the spine, just picking up these heavy speakers in 6-inch stilettos. I now wear Vivo barefoot. I don't walk around in the heels of that level. And I have taken full control of every aspect of my health, from my diet to meditation, to rest and relaxation. And I have followed Dr. Perrin's advice to the letter. And I did in the early stages think, I know best, I'll just do a little bit more than what he's advising me to do. And actually, you can't with ME. The more you push through, which is how we are used to being, and you yourself, doctor, had been through this yourself, the more we push, the worse we feel. You have got to almost give up, give in, but not give up, I say. So give into it, rest as much as you possibly can. And in my case, 11 lost years. But you know, the great thing about Dr. Perrin is he can give early diagnostic. So if people can find Dr. Perrin, we're talking young children, many of whom are approaching me today online, wanting advice, little children that are suddenly collapsing, bedbound, and they don't know why. They were once dancers or singers, and now they suddenly can't move. So my heart is to reach out to the whole community.
Brilliant. No, that was really that's a really good summary of what all the aspects around ME, because I think it is that type A personality. It's the obviously the trauma that's happened to your body at some point, and then you've got the toxic exposures. Often, I saw in your background you'd had lots of antibiotics, lots of vaccines. You know, so all these different things that then your body cannot deal with it, and there was some emotional trauma. But as you say, plenty of people don't collapse with ME, and it seems that this structural abnormality is the key that Raymond Perrin has unlocked. Now, you mentioned, because you slightly alluded to this, the sense that there's been a story, hasn't there, in the mainstream medical world that this is psychological, and ME patients have not only over decades had to deal with this catastrophic illness, I mean, that leaves you unable to work, it leaves you unable to just do normal daily functions or to enjoy life or just to do, and yet you look on the surface fairly normal. So it's been very easy for doctors to say, well, there's nothing wrong with you. And of course they do their tests and nothing shows up. And I wonder, like, at the point where you met Raymond Perrin, I think in your book it really came across how important it is to be believed, because you obviously had your partner who had ME. So he he was affirming that you have ME, and your best friend, I think, was very supportive about what's her name, Sarah Flanagan. But beyond that, you're often met with disbelief or this idea that, oh, this is in your head, or are you depressed? So talk a bit about like this, how it felt when you had a medical professional, Raymond Perrin, actually affirm to you that there is something seriously physically wrong with you, and that he could understand, what was going on. This was physical.
Thank you, Doctor. I think that's a really, really great question. For me personally, for my own GP, if you like, to be just following the modality of the current system or the previous system prior to 2021, because now, of course, ME is a physical condition and the NICE guidelines have been changed, which was my campaign through Parliament and many others alongside of me. But what's really important that I want to share is that when people look at the emotional and the psychological aspects, those parts of the brain, which we discussed earlier, the hypothalamus, they control emotions. So Dr. Perrin explains succinctly that if you get toxins in the hypothalamus part of the brain, then, and they cannot release, you've got neurotoxins building up, a high level of neurotoxins, which is what is created from emotional stress. And he says it's not just stress from running businesses or as yourself as a doctor, a high achieving stress. It's also stress from adrenaline and excitement. So that's really interesting to share because I was very excited my whole life. I was a very happy person. So that's so important to share. And that's why I have in my book lots and lots of people who have worked alongside me in the industry, in entertainment, all affirming and quantifying that Kathy was always laughing and always happy. So, the stress, of course, was going on stage and the adrenaline addiction, if you like, always trying to be perfect, racing around, running around. So stress isn't just depression or anxiety, quite the opposite. But most important, it's the neurotoxic buildup that stress builds. And the majority of patients only have stress as their secondary issue to the spine and cranium issues. So the majority of patients do have emotional toxicity, but there's always a structural issue precipitating that.
Yeah, and I thought it was interesting because you've said, oh, it was a sudden collapse, but actually reading your book, your health was not in a great way for all through your 20s. I know you said at the age of 20, you had no time to eat, drink, sleep, or rest, but you had multiple symptoms which were escalating all the time in severity. You were kept collapsing. And I was reading this book thinking, how, do you look back and wonder how on earth you managed to keep going for another 20 years at the pace that you lived your life? I mean, I think it really, your book really brings out your incredible drive and determination. You said the show must go on no matter what. You somehow kept going even when you had health challenges, from your teens onwards. So do you look back now and just think, how did I get through to 39? How did my body not break earlier?
Yeah, great question. I had health issues, doctor, from the day I was born. My nana saved my life, rolled me across the floor. Lily Higginson, she saved my life as a tiny baby. I turned blue and she stuck my head under a cold tap and I was only months old. So I take the reader right back to the beginning because I think that's so, so important. So that I would have been a cot death. And once again, that opens up the question of why. So I asked the reader to have a look at everything that happened. My mother said that in 1976, especially living in the north in Lancashire, we were one of very few people to get a telephone landline fitted in 1976 because we kept having to be red lighted to hospital all through my baby and young years, basically. So I was constantly sick my whole life, 25 years of tonsillitis, every 3 weeks at university, to the point where the doctor said, just leave the tablets on the front. If somebody called Kathy rings, just give her the medicine. So the point is, I feel in my journey that I am lucky. As you said, I am so lucky to be alive. Finding the balance is key. but understanding exactly why this happens. So I obviously, in Dr. Perrin's view, had undiagnosed ME with a jaw misalignment from birth. I was then diagnosed with vestibular damage, which is inner ear damage, which I still have today. So these are the things that can happen as secondary issues when the brain isn't draining fluid properly and efficiently. So as soon as Dr. Perrin, as an osteopath, realigned my jaw, I said, it feels like a tap has been turned on in the top of my head. And he said, only the most severe cases can actually feel the fluid draining through the brain and through the ears. And so same thing happened in my spine. When he cracked the spine, suddenly it felt like a waterfall going up the spine. Isn't that incredible? And only the people that have experienced it would be able to share that understanding, because most of us, most healthy people, can't feel it. But I want to also share, I feel very, very lucky to be alive. I do. And that's so important to share, because some people, many people actually, have suffered ME, sometimes from young childhood. They've had sometimes 40 years in bed, in the state that I was in, unable to move. I had 2 years in and out of bed. Every time I crawled or went anywhere, I would crash. And so it was a constant pushing, crashing, pushing and crashing. And then, as you said earlier, in 2016, I met everybody's hero, which is Dr. Raymond Perrin. And he sat opposite me and he said, I believe you. And that, as you said, that was all I needed, because very, very few people, as you say, had believed me. My partner, Mark Singleton, he was the opposite of my personality in terms of, he was into Tai Chi. He's a Tai Chi instructor. He's a healer. He is into meditation, and he helped me to learn these modalities in my healing. So it's, again, two different people, one with big muscles, a man, and one petite little lady. How have we both got the same condition if we physically look different? And the combining finding from Dr. Perrin is that we both have a flat upper thoracic spine. So when we were both weight training in the gym, for example, before our paths came together, we were both pushing beyond the boundaries. And as you quite rightly highlighted at the beginning, there's over 100,000 toxins. So no two patients could possibly be the same. So somebody who is exposed to carbon monoxide and paint fumes, because if you'd stood still long enough, I'd have painted you. I was somebody that painted my entire home, and it's quite large, and all the garden fences. So I didn't know that in itself is highly toxic. Now, to a healthy person, of course, they can drain those toxins out. They might get a bit woozy after exposure to paint, but eventually the body will drain it. In my case, as you read at the end, I said the detoxification was like Mary Poppins' handbag. There was so much poison to come out. I was expecting a lampshade to come out next. It was just an incredible detox. And 8 years every single week of having my brain drained is testament to my belief system in this treatment. Now, I do want to highlight that I did also implement strong diet strategies, including work from Dr. Sarah Myhill, who is wonderful. She's coming on my podcast soon, in the next series that's about to be released. And she highlights the importance of gluten-free, sugar-free, dairy-free, and also no alcohol. I mean, interestingly, I couldn't drink alcohol, and neither could Ma, without getting sick. And Dr. Perrin explains that in ME, the NMDA receptors in the brain are already fast firing. So if you then put alcohol into the system, you are then creating an even bigger torrent of the fight or flight system. And the sympathetic nervous system controls the lymphatic system. So the lymphatic system is then triggered by stress or alcohol or excitement or chemicals. So that is why. And if the lymph is draining backwards and forwards constantly, then that means everything is swooshing upwards and down, including blood, would you believe, in women. So that is why often blood flow goes up, and sometimes Dr. Perrin has said into the lungs, and you can get clotting, which is what I had, which means that anything sticky that I eat, such as fruit, sticks inside. And the cyst in my left kidney, would you believe, has completely gone thanks to the drainage mechanism now working more efficiently.
Brilliant. And well, I sort of want to move on to your campaigning, because you know, despite the fact I know you haven't fully recovered yet, but you've become a real warrior for ME. You've become an ME ambassador, and I know you've managed to get Raymond Perrin on board, and together you've managed to implement some massive changes, not least the changing of the NICE guidelines. Do you want to just talk a little bit about that sort of campaigning you've done, and how you've been lobbying MPs, and what you were aiming to do, and what you were aiming to achieve, and what you have achieved?
Thank you for that lovely analogy there. I basically, in 2016, as soon as I found Dr. Perrin, I said, "You make sense." I mean, I couldn't speak properly. I was flopped over a wheelchair dribbling, but I thought I was saying, "You make perfect sense." And he remembers it better than I do, because it was a very difficult time. But basically, straight after that, I was straight on the phone to my MP. And I wrote emails, I think every single day almost. So my MP was Sir Ben Wallace, who was the looking after Lancashire, which was the ex-defence minister. He came straight to my home, I have to say, because I couldn't go to his local cabinet. He came straight to my house in Lancashire, and he believed me. So he was one of the first people, and he said, you're the first constituent of mine to broach this subject, and with ME to be such a big campaigner. And I said, if a man at the time for nearly 30 years has been treating and diagnosing this condition with success, it makes perfect sense that Dr. Raymond Perrin knows what he's talking about, because that would make sense to me. So I couldn't understand why his work wasn't already in the NICE guidelines. What I then unpacked was in 2010, the ME Association published an article, which I've put in my book as well, that said that a patient survey showed that in the ME Association website under Dr. Charles Shepherd, first, that was the most beneficial to patient recovery. First was rest, then pacing, and third was Dr. Raymond Perrin. That's third in a long list of strategies and approaches to health and healing. So that is really, really profound. So I'm hoping that the ME Association can reflect on that and hopefully bring Dr. Perrin into their work ahead as well. There's a lot of ME groups out there that we want to get involved so that we save lives, because that's my mission. I knew that it was the most chronic pain to be in, to collapse as I did. It felt like I'd been set on fire and crushed with a concrete slab. No human being should ever suffer for years in that level of pain. And I believe now that with my mission, as you said, to campaign through Parliament, I wanted to get it very clear, which is why I've told my story, that I was not a lazy housewife, because I'm not married. And I was not a shirker. I did everything myself, to the point of, now I am learning to, to give other people jobs to do, because I can't do them now. But I was somebody who was very self-sufficient, like you say, type A, like yourself. But Mr. Wallace, I have to say, and Zoe Dommett, who was his PA, they were by my side throughout with my mission. And I went with Dr. Perrin to Parliament against Dr. Perrin's advice, because I collapsed on the steps just after our media photograph. I literally collapsed on the steps next to Mr. Wallace, and he could see firsthand that all the effort of just getting on a train, that's all I did, caused me, when I got home, I had to be carried off the train, which Mark Singleton, my partner, carried me off. And I actually was rushed in an ambulance straight to hospital. So this, just from getting on a train, but I knew that my mission would be worth it. And after that, the suffering, as we've described, it's not what you do, it's what happens after. But Mr. Wallace gave us 2 hours of his time. It's normally 1. And Zoe Dommett was present as well. But because there's a lot of electricity, light, sound, and high stimuli, which I suffer with in particular in the Parliament building, it didn't take long for my arm to shake, as still happens today, and then my legs buckled. So obviously between Mr. Wallace, I had one arm linked on each Dr. Perrin and Mr. Wallace, and they dragged me out of the front very respectfully. And that's what I wanted to do. I wanted to show, I thought, if he sees this and what actually happens, and he sees a very positive human being who loves dancing and singing, and I can't wait to get my career back. I that's been my oxygen, So I love working and being active. And of course, all those things were taken from me for 11 years. So I hoped in my mission that I could prove this is not psychosomatic in any way, shape, or form. I'm not anxious. The week before I collapsed, I was doing a stand-up comedy show in the army barracks, and I jumped off the front of the stage. And then I also was not depressed. I was extremely happy and excitable. And Mr. Wallace, I have to say, supported me, as did Zoe Dommett, throughout my mission. And in 2021, in fact, 3 months after we went to Parliament, the NICE guidelines were then discussed, and Mr. Wallace sent some documentation, including all of my emails, to the Health Minister and other MPs as well, who I'd reached out to. And the NICE guidelines were then on the market for being changed. And of course, as we know, in 2021, they were changed. And I felt, it was the best sort of outcome in medical history for 100 years. Many people before me campaigning as well, and alongside me, of course. I did not do this all on my own, not by any stretch of the imagination. But Dr. Perrin got to tell Mr. Wallace all about his work, and we hoped that Dr. Perrin's aid to diagnostic, which was Mr. Wallace's mission as well, we hoped that would end up on the guidelines, and we're still hoping that today.
That was a massive achievement. So well done for that on behalf of the whole ME community. And I just want to bring in Diane. Diane, I'm sure you've got lots of questions.
I guess I would like to as well use some of this time to address the larger, broader picture of chronic illness, chronic conditions, as someone who, as far as I know, I don't have ME, but I have, for example, I've had endometriosis for most of my life. I wasn't diagnosed until I was 21, but I was sick since I was 12. And I've found that sort of Western medicine has not been an answer in a lot of cases for me. It's made things worse rather than made things better. I've tried different types of alternative medicine. I've tried acupuncture. I currently see an osteopath. I've tried massages. I've tried a lot of different things, energy medicine, which I practice myself. But I guess there's a lot of people out there, and I know that a lot of our viewers at UK Column have their own health conditions or have friends or family members that they care about who do have health conditions. And of course, there's the vaccine injured who are dealing with a range of issues right now. So I'm just wondering if maybe we can have a little bit of discussion for awareness for different kinds of things that different people deal with. And I think, speaking from a personal perspective, it's difficult when you have what's sometimes called, unseen conditions, if that's kind of a word. It's kind of an unusual word, but it's sort of like we have things going on inside of ourselves that nobody sees. And so they expect us to be like, oh, I think we mentioned that earlier, sort of like, oh, you look fine. So what's wrong with you? Why can't you show up to work and do everything like you're supposed to do? What's your problem? And then they think it's all in your head because it's not visible. So I'm just wondering, I'm really interested in the vaccine injury issue and also the possibility of what people are labeling as long COVID, if that might be something that is, whether it can be classified as ME or some other sort of ongoing condition. So I'd be interested to hear from both of you if we can maybe branch this discussion out a bit more, just to help as many people as possible. So not just those with ME, but those who are living with lots of things that are very debilitating. Liz, do you have any thoughts on that?
With my experience of ME, as soon as there was COVID and then people were talking about long COVID, to me, what they were describing was ME. chronic fatigue syndrome, post-viral syndrome. This is, a classic trigger for ME. So, and it's, in a sense, it's a bit of a shame it's been labelled something different, because actually I think, finally the world woke up to post-viral syndromes with long COVID, but then the people with ME weren't being they've been ignored for years and years, and then suddenly the long COVID people get, clinics especially, but actually they have, we need to bring this together, because it's all part of the same syndrome, and probably the same approaches, and having research into long COVID or from ME, you can bring it all together to help everybody. So I don't know what Kathy's thought is on that, but and again, then with the vaccine injury, I think that's causing a similar sort of catastrophic, multi-systemic, inflammatory, toxic illness. So I think all of these things are linked, and just because they've got different triggers doesn't mean they're not, under the same umbrella. Would you agree, Kathy?
Yes, thank you, Dr. Liz. I do wholeheartedly agree. In fact, Dr. Perrin's second book is about long COVID and post-vaccine syndrome. So he's the expert on this, but he does call it, and the ME community call it, long COVID /ME, which is quite interesting. Because like yourself, as soon as I saw people suddenly collapsing in 2020, I was then ringing people from the BBC or anybody that I saw collapse, because I was obviously still in bed. And I continued my campaign, and I'd say, you look like me, you've got what I've got, So it was very hard for me to unpack that this was obviously something potentially different, but with overlapping symptoms. And I think that's so important. It doesn't really matter what the disease name is. To me, what matters, and what always mattered, was how to save lives. So if we have, as Diane very beautifully expressed, if we have other underlying health conditions, then perhaps Dr. Raymond Perrin's treatment, alongside a healthy diet and other healing modalities, would also be beneficial to everybody, which I wouldn't doubt. And that's so important. Obviously, that's ME and now long COVID and post-vaccine syndrome are his specialist areas, and fibromyalgia, of course. But what's important is, could other people benefit? And I believe wholeheartedly that they absolutely could. So very often, just to reflect with Diane there, very often, if we, for example, have a spine misalignment, we might lean to one side, for example, and when you stood in a bank or something and you're suddenly aware that you're leaning to one side, something I used to do. And what Dr. Perrin does is he restructures the alignment of the spine. So I sit more straight now. I was very much leaning to one side because there was a misalignment there. So wouldn't that be interesting that if we could perhaps, and this was something I wanted to campaign through Parliament about, maybe we could do tests on children like I had in school, but have a look for pre-diagnostic signs in children of these structural issues, which were evident when I shared my own story, that, when I was told to touch my toes and I could get my elbows onto the floor. So these are the things that are very, very important. And you're right, endometriosis is often a secondary symptom of ME. And again, if Dr. Perrin's explanation of the blood flow pumping backwards under high stress, or a structural issue compressing and not allowing the drainage mechanism to work succinctly, endometriosis is also potentially blood flow that's coming upwards and potentially into different parts of the body. And so that's really important to highlight as well. So yeah, there's lots and lots of different symptoms that overlap. And in the past, ME was once called yuppie flu. And my mum said, well, it didn't come to Lancashire because we're not posh enough. So I would assume that ME, which is inflammation of the brain and spinal cord, it has to be both. So it's myalgic encephalomyelitis. And in your worst state of this condition, I say, if you can say it, you've not got it. So fancy giving people that can't speak a disease called myalgic encephalomyelitis. So So yeah, it's probably better to say I've got anxiety. You can say that. But most important is to educate people that absolutely, first of all, like a tree, if we see our body like a tree, if the structure in any way, shape, or form is misaligned, from a blow to the head, a car crash. So I was punched on the way to school when I was 13 for no reason. It was somebody who didn't know me, an easy target because I was petite. So she just punched my friend, and the next day punched me on the nose and broke my nose. I didn't know it was broken, but it did shatter blood all over her. So it was pretty obvious. But I didn't know my whole life. So I then went through my whole life with a misaligned jaw, a broken nose, and mouth breathing because I was hyperventilating, not enough oxygen. Then, obviously, as you've just said, all the medication for all these different symptomologies. And it's important to share today. A lot of people ask me this. What's the significance of the neck and recurrent tonsillitis, which is what I got? And the significance is that the main lymph nodes, the main body, the largest amount of lymph nodes are in the neck. And I had that quantified with Dr. Perrin in America last week, just to make sure that I shared that correctly. So your main body of lymph nodes is in the neck area. Hence why, if your drainage isn't working, you're going to get recurrent tonsillitis. I have never had tonsillitis since Dr. Perrin's treatment. I've never had a common cold in a pandemic. I have never, because I had a succession of flu-like symptoms from the day I started Dr. Perrin's treatment. And actually my whole life, I was constantly, the nasal drip, and constantly sick. And I actually went blind twice in my recovery. My sound, I had to have blackout curtains and ear defenders. It was so acute that it was just unlivable and unbearable. And I had what I call like explosions in my head where I would jolt awake and things. So there was obviously, it seems, the drainage of the brain, when it isn't flowing properly and it's backflowing in the skull as well as the spine and all over, obviously you're going to get all of these very interesting symptoms. Also, it's important to say, if you cry a lot, brilliant, because that means your drainage mechanism is working. When I cried, it would burn my eyes. And we now know that it was so many chemicals that were coming from the eyes. Dr. Perrin explains that the drainage of the brain, the glymphatic system, goes down the skull, past the eyes, down the nose, through the ears, and down the throat. And so obviously, if that is misaligned by the neck, as we said, or any structural issues, the drainage mechanism isn't going to be excreting those toxins efficiently.
I just want to throw some different ideas out there, because these are things that viewers will be aware of who watch UK Column frequently. Is that if you watch, for example, Dr. Sam Bailey's interview that she did with Charles Mallett recently on the idea of viruses and whether or not a virus is actually a virus in the way that most people think of it, that there might just be a detoxing process happening that you don't, and this kind of what you said, Catherine, without being a scientist or knowing the details behind it, the science behind it, the way Dr. Sam Bailey does, is that I'm wondering if there is more to that we need to learn how to understand, that a virus is not something that goes from person to person. It is something that your body can have things in it that it needs to get rid of, and then you have the symptoms and you feel bad. But if you're saying that your brain got drained, if that's the right way to say it, and you're no longer having sore throats, you're no longer having runny noses, that maybe it is actually a detox process and not a so-called virus during a so-called pandemic, which a lot of UK Column viewers do question whether or not that was really a thing. So I just wanted to throw that out there, that you kind of confirmed the way that I tend to believe, is that there was no virus in 2020, and that we do have to find other ways to keep ourselves healthy, because there are different things that cause what happens to us when we don't feel well.
Journey of recovery, sort of having been a conventional medic who took multiple antibiotics, multiple vaccines. Obviously a vaccine triggered my my ME, and I very quickly realised that there was nothing Western medicine could offer me to get better, and I was not prepared at the age of 25, 26 for my life to be over. I wanted to be able to work again, to be able to play sport again, to be able to have a family. You know, I've got 4 children now, which I'm very blessed to have. So I realised you need a paradigm shift. You've got to stop looking at symptoms, because symptoms are usually actually your body's attempt to get better. So we shouldn't be at war with our symptoms. I think often Western medicine sees us as at war with our own bodies, at war with our own immune systems, you know, autoimmunity, your body's not working properly. But actually, if you get below that and actually really go down to root causes and recognize that given the right ingredients, so that the nutrition that's going in, the right environment, so taking away the toxins from your environment and the stressors which are causing dis-ease, and just, you know, any structural, malalignments, correcting those, basically getting your body, you know, from a holistic perspective as optimal as possible. If you have had psychological terrible traumas, then deal with that as well, because we are, you know, mind, body, soul, we're all kind of together. Then actually our body has an incredible ability to heal and repair. And that's what we can allow to happen. So, you know, I now treat people with all sorts of chronic diseases, including ME, but I never say that I'm getting them better. I help their body to heal itself. And that's what we've got. It's a total. So I'm then not treating an illness. So people will get, you know, come to me and say, "Oh, can you treat celiac disease, or can you treat ME?" And I'm like, I'm not treating an illness. I'm treating your body and all the things in your body that are suboptimal at the moment. And once we can correct them all, then your body will be able to do the thing it was designed to do, which is to heal and repair. And so I think, you know, so what you say about viruses, yeah, I mean, we certainly have respiratory illnesses that appear to spread, but, you know, I quite like Dr. Zach Bush's idea that these are actually our bodies adapting to toxic environments or responding to toxins, and they can make us sick. And sometimes the adaptation can actually kill you, but it's not that you're being attacked from outside. It's actually something in your body that's having to be tried to be healed. So, yeah, I think often we get, you know, when you have a fever, that is actually going to, you know, deal with whatever you're being infected by, for example. So the worst thing you can do is take a paracetamol to reduce your fever. I always say it's like you wouldn't send your children into a boxing ring without gloves on or with their hands tied behind their backs, which is effectively the minute you lower a fever, you've removed the body's ability to fight infection. So all of these things, we see the wrong, we attack the wrong things, we try to correct the wrong things, but don't see what's driving it and actually recognize that it's, you know, if we can make the soil right, then the germ is kind of immaterial.
Yeah, I think that's really important what you've just shared as well, because the most important thing is that the lymphatic system, which is congested and running backwards and forwards in ME patients and fibro patients, that is detoxifying large toxins. That's what Dr. Perrin has highlighted for me to share today, that the lymph and glymphatic system, his specialist area is the drainage of the brain. Now, he predicted in 1995-96 in his PhD thesis that there was a glymphatic system because there was one in dogs and monkeys and rats. So he said there has to be one in the human brain. So this, for me, was the one connecting factor that brought the whole community together: the glymphatic system, the inefficient drainage of the brain. And that particular area, he said, the lymphatic system is responsible, if I've got this right, for removing 50% of toxins. They remove large molecules. So he explains that the blood removes small molecules. So if the lymph is congested, eventually you get what's called varicose lymph, which you can have a look at on your own body. So men and women can get varicose lymph. So in my case, it was at the top of my thighs and also under my armpits. And it looks like varicose veins, which are blue. but they are actually white. And if your lymph becomes so congested, and then you put more toxins into the body to have to perhaps kill said infection or whatever the modality has been, then you're building the body up with more and more toxicity that it is unable to detoxify efficiently. And you've got to get the system, Dr. Perrin said, pumping the right way. So standard osteopathy is not beneficial to ME, because with Dr. Perrin's Perrin technique, the majority of the lymph is in the breast tissue, in men and women, of course, and the sides of the spine, which is the upper back. So the breast tissue, the upper back, and the tummy are the main areas of lymphatic drainage. That's the main areas of where the large molecules are being removed. Hence why we all have IBS symptoms, because they build up and then they congest. And if they are not all detoxifying efficiently, then of course you're going to get a buildup of these toxins, which, where are they going to go? They're going to pump backwards and they're going to go in a circle. And when you do the Perrin technique, often as he's pumping the system, the toxins still have to go in a circle. So halfway through one of the treatments, when I got home, the toxins were coming past my eyes. And of course, I lost my sight because the toxins are traveling past the eyes, which could explain why we can't see. And if they go into the ears, it could explain why we can't hear, because my hearing was like hyperacusis. So my sound was affected because of the toxins stuck inside the inner eardrum. And I was also, don't forget, on stage. I find a lot of entertainers working under high levels of electricity are really suffering, because imagine an electric current constantly on stage going through your brain. That's not going to be healthy for anybody to have that level of sound.
Kathy, this has sounded really interesting, but of course, Dr. Perrin is only one man, and you get him once a week, and some of us have never seen him one time. So is there another way or other options that we have to receive the treatments that he offers, or to at least learn about them?
Absolutely. Dr. Perrin also has his own book called The Perrin Technique by Dr. Raymond Perrin. And of course, the second book, which is Long COVID, for people who have been diagnosed with that. And basically, he has Perrin practitioners all over the world. That's really important. In fact, he is invited to guest speak at the World ME Conference in America. So very, very few people, Diane, are actually invited to guest speak. There's lots of people invited in the audience, but because of his incredible specialist area, the drainage of the brain, he's actually a guest speaker. And he is currently now traveling all over the world, training up Perrin practitioners. So if you're an osteopath, a doctor, a chiropractor, or somebody that can do cranial sacral therapy, you have to have the cranial sacral therapy to be able to do this, then you can actually get in touch with Dr. Perrin, which is on the website, the Perrin Technique website, from anywhere all over the world. All of my campaigning on socials, there was a lady from Washington with ME, and after 8 years of following me, God bless her, she flew all the way to England to meet Dr. Perrin in person and shake his hand. And she has then paid it forward by returning to Washington and helping a local osteopath to set up a clinic there. So every time we help somebody, they then go on to pay it forward and help somebody else. And that's what life should be about. And I hope that, this can continue with wonderful people like yourselves here as well. And so if anybody wants to access the Perrin Technique, the details are in my book as well. You can buy his book. That will explain the science behind it as well. He very kindly said that he liked my book and it was very laugh out loud. So I don't want people to think it's just a medical book. It is, although it's got science and medic in part, it is my life story, my funny, I hope, life story on stage, with the Ronnie Scott Orchestra, Phil Cool, Frank Skinner, all the different people that I work with in my career, and hopefully makes you laugh. And the brilliant stand-up comedian Steve Royal has endorsed very kindly the front of my book. And he said, what an amazing story. This shouldn't be laugh out loud, but somehow it is. So you can access Dr. Perrin, as I say, through the website or through the clinic itself. If you Google the Perrin Clinic, which is in Prestwich near Manchester, and also he has practitioners UK wide ready locally to you that you can access, and there's a big website connection. And he's just said to me in New York last week that it is everywhere now. America is now setting up his clinics, which is just incredible. So I hope that helps everybody, that there is hope. If you have got ME and you know somebody locally who would like to train with Dr. Perrin, then you can actually go to your local doctor or osteopath, and they can actually qualify in this and then treat you. Because as I said earlier, standard osteopathy is not the same thing, because with ME, our system is pumping backwards. If you do standard osteopathy or standard cranial sacral with ME, it has to be that you pump the system against the flow. That is so important. And that is why some people can end up more poorly when they have the standard osteopathy, whereas this is a specifically created modality that he has created himself over 40 years. And of course, with success. I think there was an 86% success rate on his aid to diagnostic in the peer-reviewed studies. Now that's huge, 86% success. So have a look at all the studies that he's created. That is what drove me to believe in him. And Jonathan Ross was on Loose Women with his daughter, also talking about Dr. Raymond Perrin, because she's got fibromyalgia. So I say, doesn't matter what you've got, go and get yourself help. And I'm sure that there'll be a Perrin practitioner near to you that's able to support your journey ahead.
So unfortunately, we're just about out of time. I'm wondering if I could just have a last word from both of you. I will start with Liz, and then we'll go back over to Kathy.
Just out of interest, it is World ME Day next Monday. And I know that we're about to have a delivery plan, a long-awaited delivery plan on ME, due to be published by the government in June. It was promised in 2022 by Sajid Javid. They had an interim delivery plan and public consultation on that in 2023. But sort of slightly bitter news is that the Minister for Public Health, Ashley Dalton, actually announced in Parliament a couple of months ago that there won't be extra funding for care or research. I just wanted to say, that's obviously devastating for people, for campaigners like Kathy. And I just want, that's not a very hopeful way to end. But I feel like until people really take this seriously, we need to get research. We need to get more funding for care. We need specialist centres. We need to pull up all of this kind of long COVID, vaccine injury, ME, stop separating them. Let's just get some proper research to look after people and care for them, and learn from people like Raymond Perrin and ME patients themselves, because most of them will describe this need for a very holistic, multidisciplinary approach, multi-modality health and healing strategies, and that actually we can help people to recover. We, as Kathy said, we don't want more people to lose their lives or have their lives ruined and reduced. So I'm just, I would encourage people to get behind the ME campaigning organisations, write to your MP, and let's try and get this to be let's get this sorted. Now that long COVID has brought this into the light and the public acceptance that we can have these terrible, debilitating long illnesses post infections, I think this is a real moment when we could really make some progress here. Would you agree, Kathy?
Yes, thank you, Dr. Liz. I would absolutely agree, because, and thank you for sharing your story as well, because every single person who's been affected by this chronic illness, including my partner, as I said, Mark Singleton, who literally helped to carry me on his back and push me in a wheelchair. So from every negative thing that happens to us, I believe light comes from that. And we were meant to meet, and he has looked after me. His father was head of clinical psychology at Royal Preston Hospital, and he's in the book as well. And there's enough people in the world, I feel, who do understand how horrific this condition is, but also have a very positive mindset, which is what I have as well. I will always have hope that the future for everybody with this illness will have a light attached to it. I think we are entering into a new world, and where people are looking at other alternative healing modalities so that they can access, you know, as you said, Dr. Liz, the body's natural innate wisdom behind its ability to heal, and looking at alternative healing modalities that suit each person. But most importantly, my heart goes out to the whole ME community, and anybody watching today, please, I encourage you to take a look at my podcast, which is the Catherine Vandome and Me podcast, where I interview Dr. Raymond Perrin as well, and also international guests in the fields of entertainment and health. And I also have my book, which is The Truth About Me by Catherine Vandome. And also today I'm launching MediTalk, which is meditation and talking therapy. Having lived predominantly in isolation the last 11 years, I do feel best placed as an ME expert, as somebody who has also qualified as a counsellor, to be able to help the community in whatever you're going through at this time. Please do contact me on www.catherinevandome.com so that I can offer you support ahead in whatever you're going through and give you hope. Because I'm so lucky to be here today. I will continue to smile and continue to be happy, because I'm one of the lucky ones that survived. And I hope that I can, in telling my story today, and thank you to you, Diane, and thank you to you, Dr. Liz, as well, that I can give hope to everybody that no matter what happens to you, there's always a light ahead, and somebody is always there for us to help us. Forgive me, can I just quickly introduce Tinker and say, Tinker, my dog, is my co-host. He's nearly 17, and I just want to introduce him because he has also been on this journey with me from the day I collapsed, and he's been by my side these last 11 years. He's nearly 17, and he has the Perrin technique as well. I do the technique on him every single night, and he's still alive. So God bless you all, and from myself and Tinker, thank you for having me on today.
Thanks, Kathy. That was beautiful. And thank you, Liz, for this has been a fascinating conversation. I just want to say UK Column will continue to investigate all of these issues. We have said all since 2021 that we will never abandon the vaccine injured, that we are there. We all know what is wrong with the NHS. We don't know exactly what is wrong with the NHS, but we know that the NHS is not there for us the way it needs to be. It never was. And we need to continue to uncover the issues behind the things that are poisoning us in this world, the corruption issues that are making this being allowed to happen, that our food is getting poisoned, that our farmers are being devastated by financial problems. All of these bigger issues are things that I think are, when we talk about the symptoms of an illness, that all of the things that are happening in the world that UK Column covers and will continue to cover are all examples of why we are in the situation that we are with our health and otherwise. So this was a fabulous discussion today of just one result of this, which is this horrible condition that has unfortunately affected both of your lives. So thank you both again for your time and your wisdom and your support for each other and for the entire community. And thank you for your advocacy work. And I'm sure that this will continue in some form as UK Column continues to figure out what we can do to not only improve our country, but also to improve the health of those of us who live here. So thank you very much again. This is Diane Rasmussen McAdie with UK Column. Thanks very much, and everyone have a wonderful day. Thank you.